Ready?
Yes.
Hi, my name is Dr. Dan Rogers. I'm Jennifer's doc, and I've been doing this for almost 40 years in alternative medicine, and I've developed some new techniques that nobody else in the world uses except me, and that's why you're seeing such a massive improvement in Jennifer's breast condition. And I really can't believe how well she's doing it yet. I can, because I've seen it so many times before. But she came in emaciated, skin and bones, unable to walk, barely able to sit in a wheelchair with a lot of pain. When we brought her from the airport, we had to even recline the seat back so she could even stand the trip from the airport to here to the wellness center. And to see where she is today, not even the same woman, totally different girl. The breast was huge. You can see from the pictures, if she attaches any of the pictures that she has of what she looked like on the breast 5 weeks ago and now. Unbelievable change. The size is less than half of what it was. All the ugly scabbing and all the rest of it is pretty much cleared up or clearing up. The tissue, especially on the upper portions of the breast and on the sides, is beginning to look like normal tissue again, rather than the ugly mess that it was when she came. I don't know how much you know about her condition, but she has metastases to the bones, to the pelvis and the groin and stuff. And bone pain is probably some of the worst pain you can ever have. And it's even worse than childbearing or kidney stones. And that's the reason why she was put on heavy opiate medications. When she came here, she was basically drugged out and hardly able, just marginally functional, not really eating or drinking or doing hardly anything. And for a number of days, I had to feed her IV while trying to beg her to drink some of the juices and eat some of the food and try to get going again. She's lost a lot of weight, which, like I said, she was basically skin and bones when she came in. She's starting to put some weight back on now, eating her food really good. In fact, the last couple of days, she's actually had 2 suppers a couple of hours apart, and she's drinking all 13 of her juices and asking for more. And so probably the last 4 or 5 days, we've been doing extra juices for her. I know some of you are wondering what the funding is, the $6,000, roughly $59.95 a week. And by the way, that's the least expensive basic nursing program that's out there anywhere. But what it pays for is basically the stuff I've been talking about. We have 24-hour-a-day doctor and nursing care. And we actually have a special nurse here working with her specifically, as well as the doctor on duty, as well as myself and Dr. Mammon. So we have actually, during the daytime, 3 docs here taking care of Jen. She's the only patient we have right now. And a lot of times we have more, but she happens to be getting everybody's complete attention. So what the money pays for is for her stay here, her room and board, all the medications, all the food, all the juices, all the doctors and nurses, kitchen staff, cleanup crew, all that stuff as well. And $6,000 is really, really inexpensive for what you get. You can go into a hospital in the States and within 2 or 3 days you spent $50,000 to $100,000 very easily. So it's quite inexpensive for what she's getting for it. But her improvements, not the same girl. When she came in, her personality was pretty lifeless and dull, blah. Now I'm beginning to see Jennifer again. I didn't know what she was like before, but I'm beginning to see a nice personality sparkling through. And when she came in, there was no smiles, even if I asked her to smile. Now she's smiling every day when I come walking in the room, big smile on her face. Her face looks better, her skin color looks better. She's had 4 or 5 showers now. The first shower is in more than 2 months. So she's doing really, really good. She's even walking up and down the stairs now to go to another room and look around and take the shower in there, which actually fits her needs better. And she's just doing marvelously well, starting to put some weight back on, starting to get some strength back, starting to do things like real people. She's up and out of bed every day, walking, albeit with the walker, and also doing her coffee breaks in there on the enema bench instead of in bed, and not using the potty stool anymore, using the regular toilet. I mean, just huge, huge, huge changes for her. So I'm just so encouraged. I know her goal is to stay here another 3 weeks, if that's possible, or even longer, but at least another 3 weeks, so that she can really get her strength back and be able to be more self-sufficient and self-reliant. And that's going to take just a little under $20,000. So if any of you out there are willing to contribute and can help, anything will help. And she's just very anxious to be more self-reliant and able. Right now she's not. She depends on us to be able to get her through the day. And I understand her concerns. I'm worried about her going back to a spot where the people don't really know how to do the therapy properly, and she's going to have to instruct everybody when she gets back. So the longer she can stay here, the better condition she's going to be able to be in to continue the healing journey. Any comments or questions or things you'd like to ask Jennifer?
Why do you do what you do?
Well, that's a really good question. First of all, I come from a lifelong belief in God. And I believe that God made our bodies to be self-healing if we just give it half a chance. I mean, how can you expect to have a building that's going to last 100 years if you build it out of poor building materials? Same thing with a human body. If we give the body, I believe the body can be self-healing. That's the way God made it to be. We just have to give it the opportunity and provide the materials that the body needs in order to be able to heal well. So doing this for almost 40 years, the first couple of years I was a bit of a skeptic. I came from conventional medicine, right out of my residency program and stuff, and I said, yeah, okay. So I had a look. But after about 2 years of seeing patients, not just cancer patients, but multiple sclerosis patients, and heart disease, and Alzheimer's, and lupus, and scleroderma, and all these things healing, and my cancer patients knowing that they should be dead already, and not only are they not dead, they're thriving, and the cancers for the most part are gone or completely gone within a couple of years, typically. And I finally came to the conclusion that, yeah, this program really does work. I grew up in a belief system knowing how good diet was to maintain good health and to be a healthy person. But I had never seen it used to heal people from such disastrous diseases that like cancer. Like an end-stage cancer that Jennifer has, and yet it works. And God gave us these rules of good health. There's basically 8 of them, way back when he first created this earth at the Garden of Eden. And Ellen White, a modern author in the late 1800s, early 1900s, reconfirmed these in writing in her book. And I encourage all of you to get the book Ministry of Healing. You'll learn so much in that book. But anyway, the real basic reason why I do this is I'm trying to follow Christ's plan. Whenever Christ went from village to village, what did he do? He healed people first for their physical ailments, because if you're suffering and hurting, you can't really think of religious things. You can't really think spiritual things. And so what I try to do is heal my patients mentally, physically, and spiritually. And that's following God's plan for us. And to see people that I know from my conventional training should be dead, alive and well and thankful. That's the reason why I do it. I have patients, for example, with pancreatic cancer. Survival rates of pancreatic cancer on conventional medicine is less than 0.5%. About 40 to 50% of my pancreatic cancer patients survive. And on and on and on with melanomas, with breast cancer. Typically, on average, the survival rates for most cancers are about 10 times or 1,000% higher for a given stage of a given cancer than what conventional medicine has. And so that's the reason why I do it, to see people alive and well. I have a patient who's one of the ladies on my callback list. Breast cancer, right to the point. She was a patient of mine back in the mid-90s. Still alive and well, still supportive, still talk to anybody that wants to call her up and tell her how good this program works. And that's what I hope to see with Jennifer. I hope to get her back in such good shape with no cancer, cancer-free, and living well, with just the proper diet and lifestyle, and living a long, healthy, vigorous, robust, enjoyable life. So if you have any questions, feel free to give me a call. My toll-free number is 866-535-8886. That's 866-535-8886. You can look at our website, Gerson Plus, that's GERSONPLUS, gersonplus.com. You can email us at info@gersonplus.com, and I'll be happy to talk with anybody or send you out an information packet for family and friends. But this program really works for almost any long-term, hard-to-deal-with problem. I have patients that have been on liver and kidney transplant lists, and they're off of them and still have their liver and kidney. Just about any problem you can think of. Paranoid schizophrenics, got them off their drugs, got them back to normal life, living a good life and working again like a real person. So anyway, this program is really a dynamite program. It's not just a cancer program. It works for almost any long-term problem. And that's because we don't really treat the disease per se, like cancer. I don't really treat cancer per se. Sure, we do. With Jennifer, we do some direct stuff that's treating the tumor. But typically with most cancer patients, we look at the tumor and see that, and that includes Jennifer's as well. The tumor is not the disease. That's what conventional medicine thinks the disease is. The tumor is not the disease. The disease is way much deeper, and we treat the root cause. The tumor is only a symptom. And that's the reason why I feel that conventional medicine fails so miserably with almost any of the diseases out there. They're giving you medications, they're doing this, they're giving you chemo or surgery or radiation, treating the symptom, which is the tumor mass, not treating the root cause, which is a body that allows bad cells to grow because the biochemistry is not correct, because the internal culture medium that grows unhealthy tissue is there. And if you change that internal biochemistry, change that culture medium, then you can't help but grow good healthy tissue, and the body's going to get well all by itself. And that's why this program works for so many different things. Anyway, if you have any questions or you want any more information, feel free to give me a call or drop me an email or look at the website. And please help Jennifer to get the money that she needs so that she'll be able to continue. You can see from the pictures that she has, or Rand has posted, how dramatic the changes in her breast have been in the last 5 weeks. And also, pretty soon I hope to get some video of her up walking around and stuff, and you'll be able to see how dramatic the changes are when she came in a wheelchair, unable to walk and hardly able to even sit in the wheelchair, laid in bed, not eating and drinking, and now she's eating 3 full meals a day, drinking 14, 15, 16 juices instead of just the 13 minimum, and starting to put some weight back on, big smiles on her face, skin looks better, first showers in over 2 months. I mean, she's just doing fabulous. Help her to realize her dream and to be able to stay here, to be self-sufficient and go home being able to teach others how to continue this program. God bless. Give me a call if you have any questions.
Thank you, Doctor.